Hello and welcome to your ImageTrend training. We are going to primarily focus on how to complete your run form on the ATS or on an ambulance transporting service. So we are at the dashboard here, and you can see right here on the left-hand side here, you're going to add and remove your crew members for the day. And for this simulation, you're going to select the paramedic as primary patient caregiver at scene and primary patient caregiver during transport. For the EMT role, you're going to select the driver pilot response, driver pilot transport, and other patient caregiver at scene. It's important that you establish these roles and select the crew member that's on board for the day, whether you're dual medic or you're 1-to-1 ratio here for EMT and paramedic. Whoever's going to be doing the primary patient care needs to have these two roles selected, and whoever's going to be driving the apparatus needs to have these three roles selected here. Underneath the unit and shift, you're going to make sure that your correct unit number here and call sign are matching for what you're utilizing for the day. It should default into primary role of this unit and level of care provided per protocol for this unit. Make sure that your medical device is selected for the one that is on that apparatus for the day. And once you have these fields all correctly filled out, you are then ready to run and generate calls once you are dispatched to them. On the bottom hand corner here under inbox settings and logout, under inbox where you can access your inbox for internal messaging and also through the web version of ImageTrend. Right here we are on Elite Field, which is going to be the main platform you're using when you're completing calls. On the right hand side where it says views, you can see right here you can change your views into different areas here. So at the very top they'll be in rectangular, you can have squares, or you can have the condensed version will show everything that is about the call, PCR run number, and the patient's name. So you can utilize that if you need to. However, we're going to generate a new call as if we were just being dispatched. And so for here, you're going to go ahead and select your call that you have here. But if you do not have a call that's generated because you have a short ETA, you can just select New Incident. And so for this, you have a blank run form here, and you're able to fill out your run form. Now we're going to go over and make sure how to fill this out correctly and all the fields you need to fill out in order to have the best hospital alerting system completed and to have your record completed in a fast and timely manner here. For number of patients, you can always usually determine that off of your CAD notes, but let's say that on the way to the call here, we finally are able to get our info. We can say that, hey, this is the call that we have right here. This is our unit, and this is time that we got dispatched to it. For this, we can see that it is still being generated here. However, we're going to have different times here that flow throughout the call. Now for run info, we're going to go ahead and make sure all of this aligns up, but again, this is just a simulated call. So you're going to be getting this information either from Fire, or if you're having to start from scratch, then all of this information needs to be filled out. Let's just say for the purpose, you're the first unit on scene and you're the first one making contact. So we can say, hey, we arrived at patient bedside 1 minute into the call. And we can just say that the patient's name is as so, and their date of birth is as so as well. We can put whether they're male or female, put in the race that's applicable, make sure you put in their weight, and then once you get to this unit's disposition, you're going to come over here into the dispositions tab. This is where you're going to then select, hey, we're going to transport this patient, or we're transporting after receiving care from first responder. So if Fire got there on scene before you, you're going to be selecting the transport after receiving care from first responder. If they are riding in with you, you're going to select transport with first responder as primary care provider. However, for this simulated call, we're just going to act like we got on scene first, canceled suppression, and we're transporting this patient. So you notice the second that we hit transport patient, it's going to show current value versus new values. It will show you the ones that you're going to replace it with. So let's say, hey, we're applying this, or say, hey, Fire shows up and they're going to ride in with you. Then you can easily select transport with first responder as primary care provider, and you can select those changes. However, with hospital alerting, you'll notice that tab appears the second that you hit that you're going to transport the patient. If you know that you're going to take this patient to, say, Scripps Chula Vista, you need to select this right away, so that way it notifies an early alert to the receiving facility to indicate an incoming patient arrival. If you change destinations, just change this right here right away, so that way the hospital gets pre-notified right away. Under here, I'm going to change these fields so no hospitals get alerted. And then we're going to again say that this is abdominal pain going on 10 minutes. And we have our primary complaint. We're going to fill out these qualifiers here. And then you can select the base hospital you contacted. So we can say we contacted Scripps Mercy about 5 minutes into the call. Make sure that you fill out your transporting agency, which is going to be you. And this helps out if you are using the templates under the narrative, so it generates all this information into your narrative here. So at this point, once you have all of this, you can then post it so you can save your information. On your vital signs, this is where you can generate a set of vitals. So if you didn't upload your monitor data, or you're just trying to get this to transfer it over to the base, you can do this and start rapidly inputting all of this information. So again, you can use this power tool at your discretion, or you can upload your monitor data and download it as so. And you can see where it lives at is underneath the assessment, and it's going to be right under here. So you can see that just using the vital signs doesn't satisfy the validation requirements. You have to do a GCS and a pain scale. So we know that the pain scale was done at patient arrival. And then let's say that they're complaining 2 out of 10 pain here upon palpation. It's a sharp pain, epigastric, non-radiating. And again, it's been going on for 10 minutes here. So now you can see that satisfies that. And then once you get to the assessment portion here for your secondary exam, you can hit the assessment power tool. You need to select before prior to arrival. On patient arrival, you did this, and you can select tags normal and individually select it, or you can just select all normal. You can then unselect the abdomen, or you can go within the abdomen and say, hey, this is what I'm going to say is not normal. And let's say that they're just complaining of pain generalized, and then more specifically on the abdomen, they're complaining of pain there. You can see right there, you'll have 2 different green fields showing where the abnormalities are at. And then you can hit OK, and that will satisfy that. We can say that the final patient acuity is mild. And then from here, underneath the run information, we can come back into here and start getting these values filled in. We can say that we respond at lights and sirens to an abdominal pain. We were first on scene. There's your CAT information. And then we can say that we responded to a private residence. Patient info for the address. If you scan their driver's license, it will automatically auto-populate into here. Or say the driver's license is no longer their home address, then you can just select patient address, same as incident address in that case. For this, you can search in all of the fields for their history. You can say they have hypertension, or you can say they have other things like a pacemaker. They have diabetes type 2. They have high cholesterol. So you can say they have all of these things wrong here as well. And the next time you run on the patient and use the repeat patient, it will generate in here for you. You can go into allergies here. You can select which allergies that they have, or if it's not listed underneath the common word bank, then you can just select this and start typing in what allergies they have. You can say they have a penicillin allergy and so forth if it's not there, or you can just use the known drug allergies if they have none. For this, you can utilize medications that they are currently taking that you have available on scene or that they're reporting. There's a couple of different things you can use on this field, for example. So say these are the ones that they're taking. They take these other medications you can find in the word bank. You can pre-fill it there. You can input the dose. I would only recommend doing this on stroke patients if they're taking a blood thinning medication or anticoagulant. This allows you to give more information to the base hospital if they're a candidate for TPA, and allows them to determine how fast they can render treatment if they are within that window. However, not necessary for you to do on every single medication unless you have a repeat offender or frequent flyer and you're just trying to have this information in there every time you run on them and you no longer have to input it every single time you run on the patient. But right here, you're going to go to the assess and intervention. You're going to go to the chief complaint, provider impression, and protocols and policies used. Right here, you're going to input the policy that you utilized here. And then you also have this hyperlink to all the protocols and policies. If you select on this, it's going to open up a new tab for you on your iPad, and it's going to bring you to all the adult, pediatrics, policies, references, and you can search them as well. I find this most useful for when you're using your pediatric protocols underneath the length-based resuscitation tape, and more specifically your ALS pediatric drug chart. So if you have a pediatric that's critical, you can pull this up onto here and have it right there on your iPad versus having to go and grab your laminated drug cards and go and flipping through that. So it's just another tool you can utilize. It brings you up to just each different color and you can just stay on the color that you're on and flip back between the tab and your PCR. So that way you can get your dosages, whether it's for defib, cardiovert, medications you're going to administer and so forth for the patient, and not having to go to multiple different sources to gather that information. Once you input your provider impression or your protocol, you're going to go to your provider impression symptoms. So we can say that they're having pain in the epigastric region. There's no barriers to the patient, no drugs or alcohol being reported on scene. It's not a work-related illness or injury. And then you're going to be left with your narrative, your transport, and so forth. So for here, we're going to say how we responded. It always defaults to emergent immediate response. If you stayed on scene, you can always put non-emergent. We didn't transport from the scene immediately. We were having to gather information and so forth, but you can choose whichever one fits for your field. You can input how the patient is sitting. Again, not a validation requirement, but these are just things you can keep accurately reflected on your PCR to look back at it later. Underneath destination, you're then going to hit the requested hospital name. So for here, we're going to say that, hey, they requested Scripps Chula Vista. The closest hospital is indeed Scripps Chula Vista. However, we went to UCSD. We went to UCSD because it was for trauma services. So we can hit specialty services and we can hit trauma. So underneath there, you can see it'll pre-fill all that information out there, and then you can come into your odometer, and you can get an accurate odometer count. You can say, hey, it was about 16.2 miles from scene. And at this point, you make sure that you get the patient signature, and that would be making sure that you have HIPAA acknowledgement and release, permission to transport, permission to treat, and release for billing. You're going to select patient sign, have the patient sign their name. You can auto-populate the patient's name, and auto-populate when they signed it. At this point, I'm going to come into here and make sure that you hit patient belongings receipt. It's not something that's required, but something to keep your butt covered. So that way you can say, hey, all the belongings that were transported are with the receiving facility. So the nurse is then going to sign this. They're going to sign their input their first last name here with their title, and you can say it was done at this time. Make sure they lock their signature, lock and close, and in that way it keeps the patient time accurate for when transfer of care occurred. This is a new feature to ImageTrend. However, please utilize this to keep your times accurately documented and keeping the hospitals and transporting crews responsible. At this point, you just have to have your crew signature, and you're going to then select, hey, I'm the one that transported and provided care. I'm going to then sign this, and that is going to take care of all of the fields or all the signatures page. You can pre-populate all three of these signatures too prior to arriving on scene to the patient, and you can have them ready to go and sign them. Now we talked about the patient belongings receipt. However, there's an additional field for this if you want to get more meticulous with your documentation. Underneath the transport tab, you can come to valuables and you can select the patient belongings. So we can say they had a cell phone, keys, they had a wheelchair, they had their clothing as usual, glasses, ID, insurance card, medications, wallet, purse, and you can select as many things as you want. If it was, say, like other or jewelry, this is where you can then free write and say, hey, they had gold necklace, gold watch, gold earrings, and so forth. You can put all of that, and then you're going to select who it was left with family, patient, staff, and then that way, when they sign this, they're saying, hey, everything under here for valuables was left with this person here. It's a good way to cover your butt in case someone says, oh, I had this and that, and I don't know where it's at now. And now you're saying, well, no, everything we had was accounted for, and it was now transferred patient belongings receipt to this person here, and they're the ones that were responsible for it. So it's a good habit to get into. From here, you're going to be left with your narrative and MRN number. And let's say before we start working on the narrative, you need to try and get your medications you've done or procedures. So let's say for this one, we started an 18 gauge and we gave a 500 ml fluid bolus. So for this, you can backtrack to when you gave it. You can put at patient arrival, and let's say it was like 15 minutes into the scene, and we did it on the right AC here, and then go back into your normal saline, and you can say, hey, they improved, and we did this again, let's say 15 minutes in. On your timeline, you're going to start getting something like this done. It's going to look a little bit more organized. Again, we can adjust this time. It all makes sense. So we got this, we got an IV in, we had their set of vitals, and so forth. So this is what it's going to start to look like as your PCR is getting completed. And then underneath the narrative, when you do your eye chart, when you generate it, now it will insert all of your treatment done. If you do it before, you're going to have to erase it and go back into it and upload it again. But try and make sure you get all your medications, procedures done. So that way it auto-generates into there and you're not having to input that over again. You're just left with having to do incident, chief complaint, history, and assessment. And then at here, you can just put transferred care to John RN, bed 12. Right? So this is the only thing you would have to add. And then you can fill out the rest of the narrative as it applies to the patient. Or receiving hospital information and put the medical record number here. Eventually, we're going to have barcodes that we just scan, and you're not going to have to input this or worry about doing it incorrectly. So we can put in that 9-digit code here and say that this is the patient's medical record number. After that, you're all set. You can also add, or actually, no, that's just it for that. So for this, you'll be able to do that, input that information, and you will be all set. For this, we can say that we can download it off of the CAD information here and say we cleared at this time. So for this, forgot to do the trauma detail, so we can say, hey, it's a major trauma, and say that it was an auto versus pedestrian, blunt. Doesn't meet any of this, but it meets this one here. We can say that it is abdominal, GI, and that's how you'd fit it if you're going to a specialty service. If you were not going to a specialty service, you would not have to fill in the trauma detail, or if you weren't transporting it because of that, you can just say, hey, it was the patient's choice. Like this was the requested, this was the closest, and they came here for this reason. At that point, you wouldn't have to fill in any of this. You would just apply all of this, and underneath the trauma detail, it wouldn't meet any of it. And you can just have it at that, and you're at 100%. You would then post it as many times as you need to, and as soon as you're done with the call, you're going to hit mark EMS incident as complete, post it, and then you will get a green checkbox. For your EKG monitoring data, you can just come into here and download each file that you did. You can do multiple files at one time and download all the cases that you generated, or if it was from a fire apparatus unit, you can come into here and search up that fire apparatus and find the monitor data for that fire apparatus and download their monitor data. That will come into your PCR, and then you can adjust the vital signs and input it and complete it as you need. Outside of that, that is all you need to know for how to complete a run form on the ambulance service